But first, medical needs put on hold as fewer people go to see their doctors. The coronavirus has a lot of people in the Puget Sound afraid to go to clinics and emergency rooms. Hello again, I'm Monique Minglavin.
And good evening, everyone. I'm Steve Rabel. KIRO 7's Graham Johnson explains how hospitals are trying to convince patients it is safe to see a doctor.
Washington hospitals say visits to clinics and ERs are way down because people are either afraid they'll catch COVID or think the system is overrun. In fact, Washington hospitals have plenty of room, and today they launched a campaign to keep people from delaying care.
Our hospitals are safe.
The chief medical officer at Swedish First Hill today talked about an elderly stroke victim who was afraid to come in. Dr. Elizabeth Waco says Swedish is seeing nearly a 20% drop in people with stroke symptoms.
There are real consequences to delaying care.
The Washington State Hospital Association today held a virtual news conference with hospitals across the state, hoping to reassure patients.
We're trying to allay some of the anxiety that goes along with COVID.
Evergreen Health, the nation's first hospital to identify a COVID outbreak, now screens people at entrances, requires masks, and works to separate patients.
We have put into place a number of tools and instruments to try and make this a much safer place.
Doctors are worried about people putting off immunizations and say they've treated patients who delayed coming in with ruptured appendixes and heart attack symptoms. Doctors at Seattle Children's are concerned about parents not getting help for kids who end up being diagnosed with things like new onset diabetes.
There are potentially times when, had the child been seen sooner, when their symptoms were milder, that they might not have needed hospitalization.
Hospitals are still working on restarting elective surgeries, which are a big source of revenue. The Hospital Association estimates in March and April, Washington's health system lost $900 million. Delaying care is a particular concern in smaller hospitals. We look at what's happening in Washington's rural areas in our coverage at 7 o'clock. Graham Johnson, KIRO 7 News.